everyone, and welcome to another exciting version of Chip Talks Health. Today, I'm honored to be to have on my show Dr. Elliot Justin. And Dr. Justin is an expert in erectile dysfunction. So we will be talking erectile dysfunction. Welcome to the show, Dr. Justin.
Great to be here. And by the way, I'm at war with the word dysfunction, and we can get into that in a moment.
Oh, okay. Very good. Very good. Do you want to start off and just give us a little bit of background and kind of what
Sure.
brought you to this field of science?
Well, my background, I'm an emergency medicine physician, short of a heart attack or a stroke, there are few emergencies that concern a man as much as a limp dick, especially a consistently limp dick. But I got into this interestingly because I was one of the founders of telehealth in this country. I founded the second oldest telehealth company. I'm kind of interested in remote patient management technologies. What can we do to empower people at home to understand and control the healthcare without having to go to see doctors? Because when they go to see doctors, they get the care that insurance will pay for. It's not necessarily the care that they need. And our healthcare system is really miserable for that reason. There is this gap. We live in this incredible age of healthcare wearables, smart watches, smart rings, smart bands, etc. And there's a gap, and that gap is sex. But I wasn't really thinking about this. I was working on a device with a doctor at the University of Utah to regulate blood pressure after stroke.
Okay.
I'm a medical sensor expert, and that professor who I was working with on that device knew the associate professor in the Department of Urology at the University of Utah. And that professor contacted me and said, yeah, would you be interested in finding out a way of counting the number of erections because they're a leading indicator, nocturnal erections, because they're a leading indicator of man's cardiovascular health. These are the erections that we have when we sleep. We all know about morning wood, and none of us want to have dead wood, but there's a lot more to it than morning wood. You know, a healthy man, I'm 72 years old, a man my age should have 3+ nocturnal erections. Some guy in his 40s should probably have 4. And there's no way of counting these things. And if that number goes down by 50% from your baseline, you then have a 50% chance of having a heart attack in the next 2 or 3 years. And when this professor at the University of Utah told me this, I was really taken aback, just the way you were, because I never heard of it. That would be like a 6th vital sign or 7th vital sign, depending on how you want to count them. And that'd be really motivating to men, because what do men care more about? Their pulse, or their blood pressure, or their erections? That's a rhetorical question. Every guy knows the answer to that one. So, I have particular expertise in this area because I live in Montana, as we shared earlier on the show. I have horses. I ride horses. My wife says recklessly. I say enthusiastically. And I broke 6 vertebrae a while ago. Unfortunately, didn't have any spinal cord damage, but that got me interested in what's been done to restore sexual function in men and women who had spinal cord injuries. And there were some claims in the medical literature, peer-reviewed urology papers, saying that they were able to neuromodulate sexual response in men with spinal cord injuries or multiple sclerosis. And that really intrigued me, because by neuromodulation, it's like cardiac pacemaking, most people are familiar with. Put an electrode inside, you have a generator, and you're able to make it work. Matter of fact, we can even pace the heart after you're dead. So to be able to pace human sexuality would be really powerful, especially in an aging population, and especially when the incidence of erectile dysfunction is 50% at age 50 and increases 10% per decade thereafter, 70% by my life. So I conducted an experiment on 2 rams, male sheep, and we got erection and ejaculation, not very strong erections, more like ejaculation, but we also got defecation, urination, so it wasn't exactly bedroom friendly. So maybe certainly not Oklahoma or Montana. Maybe there are certain streets in San Francisco or London where that'd be popular.
You might pay for that to happen, even.
So, ordinarily, what you would then do is you go out and raise some money, and you go out to Brazil or Colombia or Nigeria, and you test out some men with erectile dysfunction. I decided to test it on myself. I had a friend who's a professor of urology at the University of California, San Francisco. Went to his clinic. We placed an electrode by my cavernous nerve and pudendal nerves, the 2 everyone's two favorite nerves that no one talks about. And I felt nothing. I actually don't think we know how erections are produced in totality, because this is a very understudied area. Anyway, this professor of urology heard about this experiment I did on myself. I called it Project O for obvious reasons. And he said he decided to work with me. This is a little bit over 3 years ago. So he was specifically interested in nocturnal erections because they're a leading indicator of man's cardiovascular health. I want to look at all erections. Because what do men care more about? The ones they have when they're sleeping, or the ones that they have when they're having sex or trying to have sex?
True.
So my thought was to embed sensors into a cock ring. This doctor, like most doctors, is what I call a cock ring virgin. I am not. I'm fortunate to be married to someone who enjoys sex toys. Been married for 37 years, and I don't know how many vibrators she owns. But there's nothing for men. For men, these hard silicone rings. They pinch. They're uncomfortable. They manufacture the same way for the last 150 years, and they choke. You have to have an erection for them to work, or they choke off the circulation.
Yep.
So, and they're never caught on, and because they're not comfortable. And also because of male pride. But my thought was, well, if we're going to count the number of nocturnal erections overnight, we have to come up with a ring that allows the arterial blood to flow in, because we want men to get erections at night. We don't want to choke off the blood flow, and that's safe and comfortable for prolonged sexual sex sessions, if you will. So we have to change the material from silicone to elastomer. Elastomer is soft, it's stretchier, sticky. It has a little bit of sticky feel to it, but it allows the arterial blood to flow in. If you don't have erection, it allows the venous blood to leave. But if you have erection, it'll slow down the blood returning to the penis. So we have now we've documented like 85,000 erections. We have the largest dick database in the world.
Are you finding that so a couple of questions just in what you said. It's fascinating that, and I've kind of studied this a little bit too, and this tailbone kind of injury, especially young, seems to really be consistent, in a lot of men. But is your ring able, with the sensors, is it able to detect blood flow and nitrous oxide, I guess, flow?
We can't detect nitrous oxide. That's too granular. It's too much. We can't. We'd actually have to have, in order to detect something in the blood or in the tissue, we'd have to come up with a device that actually is inside the tissue. Yeah. And that would be invasive, much more expensive, and a much longer process. I did play around with that initially, and felt it would be an inhibition to penetrate, to get into the market, basically, and very expensive. I want something that would be within the budget of every man, frankly, who wants to assess their sexual health, whether they have ED or whether they want to avoid having ED and know what the data is. Because in medicine, a lot of the data we get is with the goal of preventive care. We don't. Yeah. We want to identify problems before they become overt. We don't. So for example, blood pressure, we pursue very aggressively. We, meaning doctors, we pursue very aggressively. But blood pressure is not predictive. It's not a leading indicator. It's association.
Right.
High blood pressure associated with
infection and hormones, right? Yeah.
We don't. Lipoproteins. Elevated lipoproteins are associated with heart disease, but they're not predictive. They don't. If your cholesterol goes from what, I'm making up numbers, 200 to 240, it's not tell you anything other than hey, you might eventually, long term from now, get a problem. But the leading indicator in medicine, that's different. That means it's predictive. So if his man's baseline is 3+ nocturnal erections per night, and that man goes to 1 or 1- nocturnal erections per night, that man has a 50% chance of having a heart attack in the next 2 years. So that's powerful.
Yeah, and I think that's fast, because that's the way I'm not a doctor, I'm a researcher, but I view, and I do have a clinic, we help people, but we view the body systemically, right? We view the body holistically. And again, in that situation, why would you begin to have lessened blood flow? Why would you begin to have that dysfunction in the penile area? there's always, it's not like God said one day, hey, you're going to have penis problems. It's something else is causing that, right? There's always some underlying cause. But then for me, it's, we study infection mainly, and infection as really the root cause of most disease states and most symptoms of disease. And that proves out for the most part. But, are you finding that? Are you finding that a lot of these, like if I go from, 4 a night to 2 a night, is there going to be some comorbidity with an infection?
Well, we're not looking at inflammatory markers of infection.
Yeah.
And that's a great point. And again, this device, if someone wants to do that research, we make the device available.
Okay. Yeah.
The inflammatory markers are significant, and I know I'm derogate from, but that's fact it's not how the cardiologists are thinking about it, and maybe they should be.
Right. No, infection doesn't really come into the modern medical thinking. It's more dysfunction, and you're broken.
Well, let's talk about that for a moment. And I will for your viewers. I'm aware of at least 2 men who've gotten cardiac catheterization as opposed to using our technology and seeing their nocturnal erections deteriorate. Now, as to whether they would die, I don't know, but they certainly were able to identify a problem.
Yeah.
And that's where the device is valuable. The device, we've had 1 man with an adrenal tumor. We've had men with significant medication side effects. And the device right now is being used to pretty much challenge every therapy for men's sexual health. Go ahead.
And I've seen like a kind of similar, and yours vibrates, right? It's got
No, it doesn't vibrate. There's a vibrator for female pleasure that can be attached to it, but it doesn't vibrate. Okay. So talk to me about like, how is it more of a monitoring system, and then you're using that monitoring to basically adjust medications or well, the medication, we doctors prescribe. Well, yes, it is a monitoring device. It measures how hard you get, how long you last.
Okay.
It'll also obviously count the number of nocturnal erections as well. It can be worn during sex. We recommend that. It can also be worn when you're sleeping. I certainly men over the age of 45 or 50 should be following this type of these markers, because they reflect their overall cardiovascular health, and they reflect medication side effects. And we doctors prescribe 2 classes of medications that are cock killers. We prescribe antihypertensives, many of which interfere with sexual function, and SSRI antidepressants. And doctors almost never warn people about the sexual side effects of medications. It's like they're hoping that, well, one, there's a reluctance to discuss sex with patients. It goes both ways. Patients reluctant to discuss it with their doctors. And 2, that doctors almost have an attitude of, well, if he has a problem, he'll come back to me. We'll talk about that. And that's bullshit, because sexual health is so important to people because it reflects their overall health.
Yep.
And it also has it's key to most people's happiness. So for doctors to neglect this is really, from my perspective, borderline malpractice. And the core problem is people want to say it's the culture. We're just afraid. We want to talk about these things. Bullshit, to my mind. I'll call them that, because we doctors ask people about their shit. We ask about their piss. We ask about all sorts of alcohol, drug use, do you own guns? We ask all sorts of questions that are potentially embarrassing and provocative. We don't ask about sex, in my opinion, because there's no money in it. Meaning, electronic health records don't have any issue. They don't demand that doctors ask these things. No box to check. If doctors could have, every man should be asked whether the problem is, do you have any difficulty attaining erection, or when you get an erection, do you lose it? That's the key question. And that question should be at every health record, certainly for every man over the age of 40 or 50.
And not so much as like you're saying, not so much as gee, are you sexually satisfied in your sex life, but more because it's a warning sign. It's a direct warning sign of other comorbidities, right? That's
exactly right. Yeah. And by the way, that's a couple of things. And I want to get back to something you just said, because I want to talk about dysfunction and what it really means, in my opinion.
Okay.
But I also want to talk about the impact of sex on other areas of your health. First, dysfunction. So 10 to 50% of men who come into this category of ED, they struggle to get an erection. They can't attain an erection. Those guys have a dead dick. That's a dysfunctional organ. That warrants going to a conventional physician and a cardiologist, endourologist, to try to figure out what is causing this. And usually it's significant diabetes or hypertension. Often that's neglected by the patient, who might be blowing it off for various reasons. That's dysfunction.
Yep.
Then there's the men who get an erection and lose it. Well, that's a problem. So if you're getting an erection and then losing it, the cardiac contribution is less. You're getting blood in. You still might have heart disease, but you're getting blood in. And why are you losing it? Well, it could range from often a combination of early cardiovascular disease, medication side effects in our experience, alcohol, recreational drug use, relationship issues. But for those men who get an erection and lose it, these men, what happened? The conventional healthcare system says, "Hey, take a pill." Well, Viagra and Cialis was commonly prescribed ones, sildenafil and tadalafil. They put more blood into the penis. They're nice, but they don't keep it there.
Yeah.
Men, if men get an erection and lose it, what they really need help is on keeping it there. So where the issue is, I'm worried about paying the mortgage. My wife, I'm just bored, or I get bored, or the issue is this baby crying in the room next door, or I'm taking 2 or 3 medications that are affecting my erections, or I drink have 2 or 3 drinks too many. Once you get an erection, the goal should be to keep it there, and the answer is a cock ring. And I didn't understand this. If you spoke 4 years ago, if you had said, "Hey, Elliot, the answer for most erectile," I'll put dysfunction in quotes, "is a cock ring," I would have said, "Really?" Because I was thinking, like most doctors, that the issue is with the heart, or with the getting heart or the arteries,
or plaque,
right. So the doctors that set the standards, the academic doctors, they see the sickest people in their practice and they project onto the general population, and they don't ask questions either. So they're seeing the patients who struggle to get an erection, but that's not the general population. And these same doctors fail to ask people, okay, when you get an erection and you lose it, what's going on? So that they've missed it. So here's what the data shows. It's really interesting, and there are now published papers about this, and other papers soon to be published about it. The incidence of erectile dysfunction goes up 50% per decade after age 50. The doctors were expecting, I was expecting, that as that erectile dysfunction goes up, the firmness of sex erections will go down, the firmness of nocturnal erections will go down, and the number of nocturnal erections will go down. Well, we're not seeing that until late 60s and early 70s. And it's not like it's some catastrophic fall off. It just starts to dwindle. And we got guys in their 80s who are still having sex. So what's going on here? Why is there more erectile dysfunction being reported? But they're getting, if you get blood in your penis at night, you should be able to get blood in your penis during the day or when you're having sex. So what's going on here? Blood is I call it fading erection due to venous leak, and all men get this.
Okay.
It's so obvious in retrospect because we all get it. When you're 14 years old, you hold a girl's hand, you get a hard on for an hour and a half without any other stimulation.
Right.
It doesn't happen to my age. It hasn't happened to me it hasn't happened to me probably since my late 20s that I would get that turned on.
Yeah.
Well, people want to say, "Oh, it's a psychological issue that you're too used to it." I think that's bullshit. I can be just as turned on here now as I was when I was 14 years old. Matter of fact, I get more turned on because I have more experience, more fantasies, more experience I can refer to in my memory.
Right.
The issue, as we get older, the smooth muscle around our venial small veins gets weaker. It's happened. If I sit, I just recently, my daughter got married in Tanzania a few days ago. I flew. It was about 36 hours for me to get back from Tanzania to Bozeman, Montana. A lot of long flights. Not that rich, so I flew economy, so I could deal with it. And somebody, my socks get a little bit tight, my rings get a little bit tight, my fingers. Well, why is that? It didn't happen to me when I was 25. So the reason is the smooth muscles are weaker and the venials are stiffer from calcifications. In your dick, what's going on? Well, your smooth muscle. If your smooth muscle gets weaker in your penis around the venials, blood leaves your penis faster. That's the way it is. And so even though we now have this database of like almost 85,000 erections, that's telling us something very important. The problem for most men, not all men, there are men with cardiac disease who have a problem getting it up, but the problem for most men is on the venous side of the circulation, complicated by relationship issues, alcohol, medications, etc. That's a game changer for the way in which doctors approach. Think about erectile health.
And is it smooth muscle tension that causes, or is it smooth muscle relax? Because it's almost the exact opposite in a woman, right?
Not really. You see, because aging women women actually have weaker microvasculature on the venous side than men do.
Okay.
So they're more prone actually to get swelling in their hands and feet as they get older. But women use vibrators.
Yeah.
So vibrators keep blood. They stimulate. It's on the pleasure aspects. They stimulate arterial blood flow into the clitoris. So it's easier for women to maintain arousal with vibrators than it is for men to maintain arousal, especially as we age.
Interesting. So are there things that we can do? Are there exercises, smooth muscle exercises?
Yeah.
Are there?
You can't go to the gym and work out to smooth muscle. So yes, having good pelvic tone is important. I don't want if men have pelvic floor issues, often due to commonly after prostate surgery or a bladder surgery, or having good pelvic tone is important. But remember the skeletal muscles, the muscles we can control, we all can. If we have good tone, it's the PCG muscle, pubic procedures muscle that we feel with orgasmic contractions. It's a minor contribuent, but the major contribuent to maintaining erection is smooth muscle. And for men, it's actually use it or lose it, and that plays into the other thing that I want to discuss, which is the benefits to overall health of sex. So it is. We doctors should be encouraging people to have more sex. One, as you alluded earlier, the very positive effect on one's self-esteem, strengthens the relationships. We know that couples that have sex 3 times a week, for couples that have sex less than twice a month, have half the divorce rate. Now that's really profound, because here we are, because we know that divorce is associated with your children and with the individual, especially men, suffering from depression, alcoholism, drug abuse, for your kids becoming criminals, finishing school, even their income, even the income of divorced kids is overall is less than those of parents who stay together. So just on that basis, we should be encouraged people to have sex. But a big study out of the United Kingdom shows that men who have in their 70s who have sex twice a week versus men who have sex less than twice a month can decrease the risk of cardiac death between 25 and 50%. Well, that's a big number. Yeah. You don't die anyway. But heck, this is, and of course the joke is for guys telling their wives, if we don't have sex, you're going to kill me. But that's, we know that in women in their 40s, another study, women in their 40s, if they have sex, if an orgasm every day, they cut the cortisol levels up to 50%, and that's a stress hormone. So wow. we talk about what can be done about the smooth muscle weakening. Have sex. It's good for your relationships. It's good for your health. We also, there's software evidence about sex benefiting the immune system and decreasing inflammation, shortening the length of the flu not by a lot, but like 8 to 10 hours. It's hard. Some of those studies are hard to actually say yes, it's definite, but there's clearly an overall benefit to having sex for your overall health. And every man over the age of 45, 50 should get a baseline testosterone, just the way he gets a baseline if he goes to a doctor. Blood protein, the way you check your electrocardiogram, the way you follow your blood pressure. The fact that testosterone is not part of the routine workup of men who are over 45, 50 is just stupid.
And that's something that, testosterone, and again, I look at things more from a, let's say, infectious disease perspective. And so testosterone is way more anti-pathogenic, let's say, than estrogen. And one of the things that bugs do when they infect you is they'll step on the enzyme that converts testosterone to estradiol.
Wow.
And that happens a lot. Yeah, that happens a lot. The other thing, a question for you though, how much, yeah, and happy to, we probably have stuff to talk about after this because I'm real interested in your sensors and there's some stuff I'm thinking about. So we may have some follow-up. But how much does prostate play into all this, into ED?
Well, obviously prostate is a leading risk factor, a leading problem for men, but it's not the biggest reason for ED. Men with benign prostatic hypertrophy are more likely to have ED. Men who've had prostate cancer and have had radiotherapy or surgery, they all get ED. And there are 2 studies using our ring ongoing right now, establishing a baseline and then monitoring their recovery afterwards, because men will see their nocturnal erections recover before they can perform sexually after they've had surgery. And that can a lot of guys just give up because the therapy you got to pump, use a penis pump, that is.
Yeah.
You need to pelvic floor exercises. There are medications you take, and a lot of men just give up. And consequently, the men after prostate surgery tend to be depressed, and the incidence of suicide and divorce increases significantly. But prostate disease in and of itself is not a leading cause of erectile dysfunction, because the leading cause is venous. The leading cause is 1, venous leak, 2, cardiovascular disease.
Okay. No, I would have assumed prostate. So that's good to know. And then what's kind of the relationship between premature ejaculation and ED? I think that's
the studies vary, but a large minority, if I were to average the studies, a large minority of men who have premature ejaculation go on to have erectile dysfunction, and we don't know why. But a ring is an answer. So we have one ring, the maximum performance ring. That's probably true of all of our rings. It'll comfortably keep a man hard after he has an orgasm. Well, the conventional cock rings, they pinch there. You want them off right away. You have to have a climax. With our rings, here's an example. These are numbers close to what it is off the top of my head. There are 2 studies comparing our ring to tadalafil. 10 milligrams of Cialis, most commonly prescribed ED medication.
Yep.
We were looking at detumescence, the time it takes for erection to go down after climax. Nothing is like 25, 35 seconds. With our ring, it was about 2.5 minutes. With tadalafil, it was about the same, 2.5 minutes. And with both together, it was 4.5 minutes. I've actually hit about 7 minutes. So if a man stays hard comfortably after he's had a climax, then he's more likely to satisfy his partner, as opposed to giving up or worrying about it. So the great thing about a cock ring, and I didn't understand this, is that it's a profound confidence booster for both people. I got this chip for the data, for the science, to figure out what is causing erectile dysfunction and assess the cardiovascular risk factors and medication. And now, most satisfying thing is reinventing the cock ring and making it something that should be used by all men. Here's the question men should ask themselves. Because typical male heterosexual response, because gay guys use cock rings, male heterosexual response to cock rings is, I don't need that. Well, it's not about need, it's about want. Mm-hmm. Every man should ask himself, do I want to rock harder, last longer, be more confident, have more intense orgasm? Every guy wants that. Matter of fact, guys who don't want that should have like a mark on their head so that men and women stay away from them. I know that's true. It's been interesting because young guys are using our ring without the technology for that reason. And getting back to myself, 4 years ago, if you said cock rings, you're going to use them regularly in the future, I would have said, no fucking way, I don't need it. I don't need it. I want it. Why do I want it? I want it because it's a confidence builder. It's going to keep me harder. I'll put it this way. I'll talk about the context of my marriage. I'm 72. My wife is 71. We're older, and we don't. Once aroused, we lose it faster than we did. Obviously, when we were 35 years old. Yeah. We don't lose it anymore. If I have a ring on, my wife can start talking about some problem with one of the kids or her mother. And previously, my reaction went, "What the fuck are you talking about that now? Making love?" And now my reaction is, "I don't care." I'm not going to lose my erection. I will if she goes on for like an hour, but and it used to be for both of us, and this is true for many couples, really 55 and up. There was a sort of, hey, we both turned on, rush to orgasm. What position? What vibrator? Sort of like a rush from both parts to orgasm. We don't have that anymore. It's much more. If a man's not worried about losing his erection, it's total.
Has there ever been any study about like how many men feel like they're good sexual partners? I mean, they're honest, and I would guess that it's very few. I would guess it's very few, that most of us feel inadequate because of erections. Most of us feel inadequate because of premature ejaculations. And, everything in society just helps, kind of magnify and illustrate that problem. The other question is circumcision. How does that play into sensitivity and kind of blood and all that, or does it really matter?
The circumcision debate goes on and on and on and on and on and on and on. I don't. I'll pass on that one. Obviously, there seems to be a slightly decrease in sensitivity with circumcision, but if you got premature ejaculation, that might be a benefit. So there's clearly a decreased incidence of STDs with circumcision, but does that apply to people who have good hygiene, et cetera, et cetera? Yeah. So it probably doesn't. So
what about that? Has there anybody ever done a study though on men's adequacy? Just
most men feel inadequate.
Yeah, no, that's
most men also are not honest with their partners. So I didn't understand until I started talking to my customers and my patients recently about this. What are 3 complaints that men have about women that they don't want to bring up with the partners? We talk so much about the importance of communication, but there's some things that men are reluctant to communicate because they're relationship killers. I'll mention one. Your pussy is too loose. Now, what guy? I'll bring in context of my relationship rather than ask about yours or anyone else's. My wife's had 3 kids and she's 71 years old.
Yeah,
I don't get the friction that I need for in certain positions, most positions, frankly, anymore. I can discuss it with her because of the nature of a relationship, but most guys would find women would be offended by that. That would be a bad question to ask.
Yeah.
Another thing that people don't want to discuss, and it's a big factor, is boredom. There are certain positions that when you repeat them 1,000 times are not particularly interesting anymore. Now, granted, if the goddess Aphrodite walked into my room right now, and unveiled herself and asked me to have sex to her in the missionary position, that would be the end of this interview. If my wife walked into the room right now and said, "Let's have sex missionary position," would be like, I'm doing an interview. I'm talking to Chip right now. I'll talk to you later on. So there's, and I'm exaggerating, but that's boredom is a profound factor. Men don't want to tell their partners that they're bored, and men are afraid to ask for what they really want. Yeah. And the other is distraction. I don't know. Many women in the middle of sex will start talking about other things or will get distracted thinking about other things. The men want to blame themselves for it, but it's not. Is it really their fault, or is it really the fault of their partner who can't focus? Not all women. So I think that most women feel inadequate as well too. And
yeah, it's and women have the whole orgasm issue, can they orgasm or not? It's they're a little bit more have you studied that at all? And I
haven't studied it, but vibrators are a game changer. And so back in the 80s, 70s, really, because I'm old, women could be described as frigid, hysteric, anorgasmic, cold. And then the feminists came along and said, "Fuck that. We're not talking about women that way anymore. Women might have problems. How can we address those problems?" And vibrators are a game changer. They're normal for women now. Back in the 70s and 80s, vibrators like, oh, embarrassing. You're going to become vibrator dependent. Well, now if you told your average woman, "You're vibrator dependent. We got to take that vibrator away from you, or you can only use low speed," the woman would be like, "What the fuck are you talking about?" Fuck you. Men don't have anything any confidence builder, and rings not be as good as vibrators, but they can play that role. And I really encourage all men to think about using cock.
No, I can really see how this would boost, confidence. It would boost, again, most men feel inadequate about something. Their, hardness, their ejaculation, if it's too early, or, something. But this would really help all those things, which is awesome. Every man should have one, right? Absolutely.
Every man who's over 45, 50 should want to know their data.
Yeah.
And follow it. And especially men who have hypertension or diabetes or depression. Because men are using this device, the tech device, not just for sexual pleasure. They're using it to assess their medications and to make changes. So we're all of us, Chip, are on the road from what I call erectile fitness. I don't want to talk about dysfunction, really. I really want to talk about fitness. Let's talk about this positively. Let's try to get rid of the shame. Women right now, they'll talk to each other about, hey, I can do vibrator, does this, that, or the other thing. Guys don't talk about ED. No, I've never had a conversation. Well, I do now that I'm in the space. But before I got into this space, I never had a friend say, hey, I got ED. What do you have it? What can you do about it? Guys don't talk about guys don't talk about it at all.
Yeah, I know. But we'll talk about our all manner of horrible, nasty stuff, but we won't talk about ED.
Yeah, exactly. Yeah, I don't. So, and we should talk about it. So we need to eliminate the shame. And again, that's why I prefer the phrase. And I think I invented it. I invented it. I can't find anyone else using it. Erectile fitness. Fitness How can we maintain our fitness? We're all on the road for fitness dysfunction. Where are we on that road? If we're going down that road, we'd like to press on the brakes. We'd like to make a U-turn or go into reverse, but we don't have a dashboard. We don't know where we are. And so what the data gives to men and the healthcare providers is tells them where they are.
Yeah.
So if a guy has 3+ nocturnal erections and has premature ejaculation or struggles to perform in bed, the issue is probably here in their head. And or in their relationship. I'm the phrase, not in their head. It's a psychosocial issue. That's really valuable for men to know. On the hand, if that guy has 2 minus or 1 or less nocturnal erections, now the guy looks at his data and says, last year I was a 4, and now at 4 number, nocturnal, now I'm at 2. I got a problem. And what's causing that problem? Is it a medication? Is it my heart? Is it my sugar? Whatever. Excuse me.
Well, how do people find you? How do people find the cock rings? How do they, are there variations in the cock rings? So, and I know I've got the website right down there, but let's verbally.
Well, we have 3 cock ring products. One is a tech ring. It does function as an erection ring, which, by the way, what I'm going to call cock ring, because cock rings sound kind of vulgar. It doesn't really say what they do either. And then, do you know what the urologists call cock rings?
No, what?
Penile constriction devices. Now, what guy with a problem wants to put on a penile constriction device? I mean, it's something like some Nazi doctor thought. Hey, Elliot, you got ED. Let's constrict it. Let's put this constriction device. I like to call it an erection ring, and because that's what it does. It supports erections. It's not going to produce an erection, but it will sustain an erection. So we have 3 devices. One is the device with technology, and it's the most expensive because it's a sex tech wearable. The maximum performance ring is our #1 seller. It is the non-tech version. It was designed to increase the male ejaculatory phase by 50%. Well, if your orgasm lasts 50% longer, that's an incredible orgasm. And it does that by putting a little bit of pressure right amount of pressure over the urethra to prolong the ejaculation. My ejaculation phase goes from 4 seconds to 7 seconds with it. And that's an incredible orgasm. And my wife jokes that she's glad the kids are out of the house because I'm noisy for the first time. That ring is really for men who get an erection but lose it. And and then there's a regular performance ring, which is for men, for larger men, or men who think they're larger. And it's adjustable. All of our rings are adjustable. They can be tightened or loosened. It is almost a one-size-fits-all solution for men who are very, very small, and that's not many million. Or for men who are very, very large, then the rings are either too tight or too loose. But for 95% of men, the rings fit.
The rings fit good. Yeah. Yeah, very cool. Very cool. No, what great technology, and what a great new way to think about, sex, and to kind of open conversations about sex. I really like what you're doing. And I never would have thought of erectile dysfunction as a kind of an indicator of cardiovascular disease. That's brilliant that you guys have made that association. Really cool
Well, that's
stuff.
actually an old association. That goes back to the 90s. I mean, neurologists called the penis
Oh, wow.
the canary in the coal mine of cardiovascular disease. But I never
Oh,
heard of it.
wow.
And
Yeah, I never had either.
yeah, because they noticed that men with significant cardiovascular disease also have ED. But there are men with again, I want to emphasize, those are the guys who struggle to get an erection or can't get an erection. Most
Right.
men get erections and lose it, and that's
Yeah.
so. A ring is a mechanical solution to that. And if a man wants to perform his best, use a ring, ours of course, but use a ring and take a pill.
Yeah. Yeah. And again, do you see that? So if I'm using a ring, will my need for the ring lessen, let's say? And I know that the ring would be a thing that I might want to use all the time, but would I build up my muscles,
No.
using the ring, so to speak? No.
Well, that's unclear, because the ring does increase blood flow into the penis at night.
Okay.
It is a little bit of constriction. So when you have an erection at night, your nocturnal erection might last a little bit longer with the ring on. But I can hypothesize that is beneficial, but to health of the penis. But I can't make that claim. I can't
claim. Yeah. Okay. Well, now this is great. So you guys out there, go to my FirmTech, check out Dr. James's rings, his erectile rings. Get one. Improve your life, improve your relationship, improve everything. So is there anything that we've missed, Dr. James, that we need to get out there?
Well, it's Dr. Justin, but that's okay.
I'm sorry, dang it. Yeah, it's my fault. Because you have you're like me, you have two first names.
Yeah, we did it again.
Sorry about that.
I just, I think that people need to plan for pleasure. I think that people are, people need to make love more, or even if they're alone. Having orgasms is profoundly valuable to your health and to your mental well-being. And people rely too much on spontaneity and allow themselves to get distracted with something that's so easy. I mean, I'm here in Bozeman, Montana. It's a very fit town. I go to a gym with really fit people, and there are guys there who are working out 10, 12, women working out 10, 12, 14 hours a week. But when they talk to me about the sex issues, they're relying up, work is too stressful, or blah, blah, whatever it is. Well, take a couple hours out of the exercise routine and put it into your relationship. Make love more and enjoy life more.
Yeah, no, love that message, my friend. That is awesome. And that's a good place to leave it. So thank you for being here, Dr. Justin. And I apologize, I blew your name there. But it's been a real joy talking to you. And again, we'll be back next week with another exciting version of Chip Talks Health. See you guys. Bye. Thank you for tuning in to Chip Talks Health, where we uncover the truth so your body can do what it was designed to do, and that's heal. If today's episode helped you think differently about your health, give us a like, subscribe, and share it with someone who needs it. Want to go deeper? Visit TrueMedics.com to explore science-backed solutions, or book a bioresonance scan at Neighborly Wellness to find out the root cause of what's holding you back. Until next time, stay curious, stay well, and keep listening to your body.